Most people think losing a tooth is just a cosmetic problem, but in the United States, it can quickly become a financial disaster. A single dental implant can cost more than a used car. In some cases, patients pay over $6,000 for just one tooth. But here's what most people don't realize. The real cost is not just money. It's time, pain, and sometimes permanent bone loss. In this video, you will see exactly what happens inside your mouth, step by step, in 3D. And more importantly, you will understand why dental implants in the US are so expensive. What is a dental implant? A dental implant is an artificial tooth root. It replaces a missing tooth. Most implants are made of titanium or zirconia. They are placed directly into the jawbone. Over time, your bone grows around the implant. This process is called osseointegration. It creates a strong foundation for a dental crown. A crown looks and functions like a real tooth. But this process is not simple. Before placing an implant, a dentist must evaluate several things: bone density, gum health, risk of infection, and overall oral condition. If any of these are weak, the implant may fail. Procedure. The implant procedure happens in stages. First, the dentist makes a small incision in the gum. Then, a hole is carefully drilled into the jawbone. This step is critical. Precision determines success. Next, the implant is inserted into the bone. After that, the gum is stitched closed. Healing begins. But here's the key part. Healing takes 3 to 6 months. During this time, the bone fuses with the implant. Only after full healing can the crown be attached. Surgery experience. Many patients are surprised by how complex this is. Even with anesthesia, this is still surgery. During the procedure, the gums are cut, the bone is drilled, and metal is placed into the jaw. The body reacts immediately. Swelling is normal. Pain is expected. Healing takes time. Some patients need bone grafting. This happens when the jaw is too weak. It adds more cost and more recovery time. Cost. Now the main question, how much does it cost? In the United States, a single implant costs between $3,000 and $6,000. But this is only the base price. Additional costs include bone grafting, $500 to $3,000. Tooth extraction, $150 to $500. Crown placement, $1,000 to $2,500. In real cases, the total can reach $8,000 or more. Why is it so expensive? Because of high clinic costs, advanced technology, specialist fees, insurance limits, and material costs. In the US, dental care is not basic. It is a high-skill medical service. Why us is expensive. In other countries, implants cost less. But in the US, you pay for more than just the procedure. You pay for modern clinics, medical insurance systems, advanced imaging, certified specialists, strict regulations. Every step is controlled. This increases safety, but also increases cost. Risks. Implants are not guaranteed. Possible risks include infection, implant failure, nerve damage, bone loss, gum inflammation. If an implant fails, it must be removed and replaced. This can double the cost. Some patients experience long-term pain. Others need multiple surgeries. That's why dentists carefully evaluate each case. Titanium versus zirconia. There are two main types, titanium and zirconia. Titanium is the most common. It is strong, durable, and well-studied. Zirconia is newer. It is metal-free, white in color, and more aesthetic. But it is less flexible and not ideal for every case. Dentists choose based on bone strength, bite force, appearance, and long-term durability. Truth: many patients only hear the price, but not the full story. What is often not explained: hidden costs, multiple procedures, long healing time, risk of failure. People expect a simple solution, but reality is more complex. Understanding the full process is essential. The best way to avoid implants is prevention. Brush regularly, floss daily, visit your dentist, treat cavities early. Because once a tooth is lost, replacement becomes expensive and complex. Dental implants can restore your smile, but they are not a replacement for prevention. Your dental health is not just about appearance. It is about function, comfort, and long-term cost. And the decisions you make today will shape your future.